you all to our fifth and final webinar of the year. Whether this is your first time joining our webinar series or you've attended all five, on behalf of the Health Leads, I want to thank you all for being part of much needed discussions that are truly designed to push the social needs / social determinants of health sector to be intentional in its operations regarding integrating equity into interventions that focus on social risk. We believe that in this current context, that this conversation is timely, and we continue to be encouraged and overwhelmed by the response by so many of you who are or who are truly seeking to be accomplices to uplift racial health equity and promote anti-racism through this work. Before we get started, especially since this is our first year conducting this webinar series, I want to thank the Health Leads team for their support, but I especially want to thank Danielle Dean, Olamide Kolawe, and my co-lead, Megan Pazaki, for all of your tedious work that often goes unseen to make this webinar series possible. And with that, my name is Archer Rogers. I am the California Director of Program, and I'll be moderating today's conversation. Now, for those who may not be familiar with Health Leads is an innovation hub that runs both national and local initiatives that address the deep societal roots of racial inequity that impact our health. During COVID-19, what we've seen is Black and Brown communities disproportionately impacted as a result of structural racism and white supremacy. And Health Leads has focused on helping communities both respond to immediate essential health resource needs and rebuild equitable systems for the future. And as we begin to rebuild those systems, we must ensure that we are not replicating or reinforcing the deep inequities in how those health, justice, and education systems operate. And we need to do that intentionally and explicitly by uplifting racial health equity. Now, as we are now in the third wave of this global pandemic, I want to center us on a slide that some may have seen before, but was created by our research and development team here at Health Leads that really highlights the compounding effects of the COVID-19 pandemic. We often hear about bending the curve of new cases, but we know that this pandemic has affected the curve of our social safety net system as well. For a social safety net, as you see in this curve being depicted, that's already working beyond capacity, we are actually stretching the social safety net system even further as there are more and more new faces who are needing social services for the first time. And so we have to look at this curve as one that makes us think of equity. So as we think about equity, we have to think about how systems have been designed. And so this framework, which comes from the National Institute for Children's Health Quality, really allows us to look at systems that have been created. Three systems that we have highlighted are savior design systems, ally design systems, and equity empowered systems. So with savior design systems, we see that the communities who are most affected by disparity, they don't have a voice. Oftentimes we don't delve into the root causes of those inequities. And again, there's little community participation in the work. So what we see with savior design systems is essentially an anchor institution or a large institution suggesting what the intervention is needed for that affected population and throwing it out there, and that affected population or that affected community has to respond to what the institution has given them. Now, some of us do a little bit better than that. We want to work with the affected population or the affected communities, so we create ally design systems. Now, we still have all the power as institutions, but we want to get the feedback from communities, and sometimes we'll even allow them to give us feedback to shape the design of the intervention. Again, with ally design systems, we don't necessarily go to the root causes and we don't allow community to spark the change that's often needed for adaptability, accessibility, and sustainability. We're really trying to push to equity empowered systems where we have the affected population, the affected communities really driving change, that we're still partnering with the communities, but we're sharing power with the communities. And we want to do that and also start to address some of the root causes of the inequities in that design work. So we uplift things like structural racism and some of the underlying causes of what may be creating the disparities in the system. And that's where we are today when we talk about tech solutions. We want to have a conversation of moving tech solutions from savior design approaches to equity empowered approaches. And I think that that's extremely needed for this time. We want to ask questions around how do we seek tech solutions allow us to understand the root causes of inequity? How do we ensure that these technology solutions are considering the impacts to both sets of end users? That's one, the community-based organizations who may potentially experience a burden from technology solutions. And then also a group that we really don't talk about sometimes, which is the ultimate end user or that affected community. Because we've seen with social determinants of health interventions, the difficulty of them being accepted, adopted, yielding the statistically significant results that we want to see. And lastly, we're talking about equity empowered systems because in this current context and time, as many Black, Latinx, and Indigenous people sit at the intersection of multiple crises, and when I say multiple crises, I mean obviously COVID-19, the economic recession. In the West Coast, you have folks experiencing wildfires and the political and social unrest as a result of the inequity that's seen across the country. While these people, and I'm a person of color, I sit at some of these intersections as well. The last thing we want to do is perpetuate a system that's about extracting from these communities without reinvesting back into those communities. So we're going to be delving into these topics and a lot more with some great experts who can talk about this way better than I can, and I'm so excited for you to hear from them. First, we have Tessa Cruz, who's the Director of Outreach and Engagement for Streetwise. We have Robert Phillips, who is the President and CEO of Illuma. And we have Julie Wang, who is the Director of Innovative Partnerships here at Health Leads. So we're about to dive into our first question. So some stakeholders view technology as a silver bullet in social determinants of health work. And just to center us, why do you believe technology-centered solutions seem to attract more attention than community or community partnership solutions that focus on addressing social risk? And beyond that, how do we begin balancing and or right-sizing the emphasis of technology over human connectivity and community partnerships regarding social needs interventions? And the reason why I ask that is a lot of times we first hear about the technology when it comes to social needs interventions, but we don't hear about what I call the nitty-gritty work that is required to actually make connections happen, which is a lot of human connectivity and partnership work. So Julie, I would love for you to start us off responding to this question, if you don't mind.
Absolutely, our chair. So we all know that the market for SDOH referral technology is on fire. It's estimated to exceed 250 million within the next 4 years, and we've already seen more than 200 million in direct equity investments secured by some of the leading tech providers in this space, Unitas, HealthFi, others. So I think we can start to better understand this perception of tech as a silver bullet by looking at who the typical decision makers are that are charged with making these types of investments. So for example, in healthcare, we continue to see increasing investments in these types of solutions. The focus has historically been around two things. One, enhancing access to quality information and referral capabilities. And then two, having the capability for referrals around essential needs. So the decision to invest or not to invest in SDOH technology is often still heavily driven by a business ROI. And the value there of many of these technologies are really centered around this notion of process efficiency. So as a result of having easier access to quality information around services that are available, folks ultimately have a little bit more time on their hands and their caseloads are a little bit lighter, as well as the quick ability to quickly refer an individual to an agency in a time-efficient manner. And this is by and large kind of the value proposition that a lot of folks are really hinging onto when they think about how do you effectively address kind of the issues, how do you effectively do SDOH interventions? So these types of performance indicators are things that can be much more easily tracked and measured on an annual basis in any kind of build of community partnerships. And even with all of that, investors are still really grappling with being able to realize a positive ROI. So in terms of your second question, how you actually begin to right-size this, we need to really take a close look at what's missing. And what's missing, and I believe many of the tech players in this space are increasingly becoming aware of this, is how critical community engagement and participation is to ensuring that the technology is able to support the type of value creation that was initially purported. So when you think about it, there's a uniqueness in these types of technology solutions in that their value and effectiveness is closely intertwined to the willingness of network members and community members who are intended to use this technology and share their data. So the value of the shared data housed within these solutions will likely only increase alongside the community's willingness to really adopt the technology. So it's incredibly important to include community in the equation. So, and to do that, we need to start incorporating the mindset of investors, the mindset of amongst investors, the notion of not only financial, but also societal value to all stakeholders as they start thinking about making investment decisions.
Thanks, Julie. You really gave us kind of a rich opening there where you talked about the current value case, especially with technology, being around the process, that it makes it easier for maybe case managers or different stakeholders to refer to a particular community-based organization, and that's what's allowing technology to be elevated the way it is. But you also brought up some critical things that were missing, critical components that may be missing from articulating the full value case with these type of interventions. And one of those was community engagement. And I want to bring Tessa into the conversation because, Tessa, it seems like your wheelhouse is around community engagement and technology. And I just wanted to see what Julie said resonated with you, and if you had anything you want to build onto that.
Yeah, absolutely. Thank you, Arter. I think building off of what Julie said, technology in the space can be really appealing because it does increase efficiency and oftentimes can be cost effective and really powerful in terms of collecting and storing and utilizing large amounts of data. However, our team at Streetwise really believes that technology is as successful as the communities and the networks that are using it, like Julie mentioned, which is to say that technology should really be complementing and assisting the community networks and partnerships and in-person interventions that we know are happening within communities on the ground. And so within our work, when we think about kind of right-sizing this emphasis over technology, emphasis of technology over human connectivity, we try to balance this by first building trust and building partnership with local community leaders, because rightfully so, there is a lot of distrust around using technology, especially when it's tools that you've never heard of or people that aren't from your community. And part of that building that trust is really talking through the intention of technology being a tool to help communities meet their own goals and a tool that they can feel ownership over and feel comfortable and enjoy using. And I think second in balancing this is actually creating tech tools that are sustainable and long-lasting, and that folks can use how they want to for as long as they want to, rather than a tool that sort of goes away if funding leaves or if a project concludes. And part of connecting that is really helping provide training opportunities and building capacity with partners to be successful in using these kinds of tech solutions how they want within the future.
Thanks, Tessa. One thing that was really struck me when you were talking, you mentioned this early on, and then you kind of looped it back to the value case, which is that technology should look to complement the community and the community's goals. And as much as we think about sustainability out here on the healthcare end with social needs interventions or social determinants of health interventions, sustainability or the ROI is tied into like health outcomes, maybe patient satisfaction. But what you're really proposing and what you're really stating is that another piece of sustainability really comes from its ability to interact well within the community, because that's what's going to allow it to be adapted within that current context. So I would like to bring Robert into the conversation, as I know that Illuma does a lot of work with public benefit screeners and really having to think about how to integrate that within the community. And just want to know if what Tessa was saying, is that what you see with the work that you're doing at Illuma?
Yeah, there's something that, Tessa and Julie said, that really kind of resonates in here. That's a real kind of core issue on this one, which is, if we're going to do social determinants of health work using technology, we really got to go at a really fundamental idea, which is this tech utopia idea, which is this notion that if you just give enough technology to something, it'll actually be the solution to the answer. And that gets driven every time a tech company goes public or one or more new philanthropists out of tech gets created, their thinking around that goes public too. And so, that idea, comes through expressed by a really simple conviction that, talent is universal and opportunity is not, which is basically a way of saying that if I can give, a poor family or poor kid, I'm here in Oakland, so if I get somebody from East Oakland the computer and internet access, they'll figure out how to kind of get it done. And the problem with that, that I hear Tessa and Julie driving that is that, opportunity really requires nurturing. And, developing opportunity and talent is messy and more unrefined work than the bits and bytes of technology. It requires kind of nuance and humanity. And most importantly, that stuff ain't scalable. And technology is really, really attractive because of scale. So when you think about Facebook and Twitter, right, Twitter has 330 million users. Facebook has almost 3 billion users. And we don't see that in the social sector. We don't see that in the health sector. And that type of scale doesn't necessarily work with the social problems that we're dealing with. And so we don't wrestle with that question, which is, technology is a tool, right? And it can amplify something that's an effective solution, but it can also entrench inequities too. So the way that we think about that, going at that question, and this is really, what I heard Julie driving at is, realigning our thinking to practically deal with this by seeing technology as a tool and not an answer. So we're not on two kind of extremes of the conversation, right? We're not on the technology kind of utopia where if only if we had the right technology, we can kind of scale what we're doing. End of the equation, but also not on the end of the equation where, we're so resistant to technology that we actually miss out on significant opportunities to broaden and deepen the impact that, Tessa and Julie were talking about organizations want. That what we're trying to do is push to integrate technology into the work of social change. And I think that's really the crux of it here, right? It's think about it this way. If we're realigning our thinking to see technology as integrated into the work of social change, you won't do something like pick a social referral platform and then think that actually answers the question around social need. Because that will incorporate the lessons that we already know. Like, you can't put a computer in the hands of a poor child like the one laptop per child initiative did 15 years ago and think that eliminates poverty, right? You can't just offer a collection of instructional videos online and like a lot of education institutions do with Khan Academy and think that eliminates educational inequity. And I'm not saying these things are bad. I'm just saying by primarily using tools that don't work in isolation, your focus is off.
Yeah, I'm sorry, I was just kind of entranced in what you were saying, especially with the utopia concept that you were bringing into the discussion. Um, and all of you just did a great job building off of one another, really talking about, Robert, you were talking about the fact that opportunity needs to be nurtured. And if we're just thinking about the scalability of technology, we're missing the fact that if we only push out that solution and think that that's going to address the issue at hand, especially when we start talking about disparities, we actually may be entrenching inequities. And that really leads, that's a great segue into the next question that I would like to ask. And Robert, would love for you to take a shot at this. We're in a current climate, we're, as much as we're in the COVID-19 global pandemic era, we're at a point where we've hit just this peak on, violence against Black and Brown people. So we're in the era of George Floyd, Breonna Taylor, Ahmaud Arbery, so many names that we're seeing organizations, whether it's, just the goodness or really recognizing what's going on, or if it's pressure, organizations are seeking to be anti-racist and promote equity. But with what you just shared and what Julie shared and what Tessa was sharing, there's some major flaws in the current investment structure of social determinants of health intervention. And I just want to know, could you expound on what you think that those flaws are so we can start calling those things out?
Yeah, that's an excellent question. So, one thing that's implicit in, what you just heard the three of us say is, if you focus solely on outcome without paying attention to intent, you cannot be the anti-racist organization that is promoting, interventions in the structures of social determinants in the way that you really want, right? Because yes, the outcome is great, but if you're not actually paying attention to who you're partnering with and paying attention to what was just articulated around what actually goes into working with community, listening to community, as well as, pushing folks to actually be equity empowered, that is a huge miss. Because intent matters in who public agencies and philanthropy and health systems and others partner with. It has a profound effect on your ability to pursue racial equity, economic equity, health equity. And there's rarely, if ever, a conversation about that. Because if your intent is to reach an outcome where you are solidly on the path, at a minimum, to just be an anti-racist organization, to be an organization that's really putting its shoulder behind addressing everything that makes up who and what we are you asking yourself, who are you intending to partner with to achieve that aspiration? Is it a set of organizations that by mission and status are accountable to the public? Or is it a set of organizations that are ultimately answerable to a set of equity investors and shareholders that don't necessarily have that as their sole focus? So, as we're confronted with this problem of advancing policies and practices that address the social determinants of health, that work doesn't stop with the victory of just making the commitment, right? Implementation is essential to that. And who and what you invest in are almost always the key to that implementation. And that is a big part missing, right, in the efforts. And why I say this is because, just to be straight about it, far too many private and for-profit firms working in this space have great demos and great sales pitches that will hit all the right notes that'll hit your ear just right. And they're structured and incentivized in ways that pushes them to hold values and engage in practices that are radically at odds with the values and practices that they're being engaged to implement. And I'll just pick on social referral platforms for a second. Who you pick when you do that work matters. This is what Julie was driving at. Collecting information and referring folks to help and support requires having basic intention to drive towards collaboration and mutual benefit. So as that work is actually premised on gathering and using the community's information and service capacity to address social needs, you have to have that intention. So whomever you invest in doing this and whoever is implementing this has to have the intention to treat the community as equal partners in order to be able to satisfy the core assumption of linking folks to help. That as you actually identify more social needs in folks, more people will look for help from community agencies that can meet them. So if your intent is tuned wrong, what we're finding is the dynamic that is created where incentives for social referral platforms to gather and use community information happens in a way where it creates a lack of trust, not just between them and the community, but between the community and the agency actually investing in them to do this work as well. And in the worst cases, it creates a lose-lose-lose situation where people are sent looking for help that doesn't exist. Community agencies, as you pointed out at the top, that are already stretched are stretched even further and often have to carry the burden of telling someone who's referred to them that's in need, no. And then the agencies, the health plan, the health system, the community clinics staff waste their time, lose credibility, and don't even get to the outcomes that they either want or need.
There was so much to unpack there. I want to bring Tessa into the conversation as well, because there was a point that Robert, you made around, again, being really selective of who you partner with, like the intention behind that. Because if you're partnering with people who are not accountable to the community, you just basically said that they may be accountable to doing things or operating in a way that may not even align with the anti-racist intentions ultimately that you're putting out there. And that's something that we have to be mindful of. So you can't, throw out that you want to be anti-racist and then, partner with a group that doesn't align with that intention. And, I think that this is something that Tessa, you could really elaborate on in your role. And there was a question that was brought up around, building trust, at the intersection of technology and community, and wondering if you could hit on that a little bit too, Tessa, if you don't mind.
Yeah, I completely agree with Robert. And I think, we've been doing this work as a small Black-owned, women-owned, people of color owned and operated group, and partnership has been incredibly important with the work that we do, and really being able to sit with our mission, our values, our goal, and understanding that if people don't have that same goal and they're not willing to learn from one another, then they're not the right partner. And that's okay. It's okay. You don't have to partner with everyone, but you do need to be really intentional with who you partner with and making sure that there's a trust there first, and that you are on the same page with how you value community and the work that you do, and moving forward with that. And sometimes not everybody that wants to work with you will have that kind of outlook, and it's okay if you aren't the right partner. It's sort of like, building this team of people that you can, this wider network and wider team of people that you can trust who are fighting the same fight that you're fighting. I I also think another thought around this, in terms of this current investment structure, it is still difficult to get people kind of bought in on the fact that these established networks within local communities do increase the likelihood of building more resource connections and bringing value to future investments. And an example of that is the great work that the Unity Council does in East Oakland around their business improvement district. And we're partnering with them to actually visualize how much value these social networks bring to the community, and how much an investment in these businesses will offer in return, but also how it'll make a big impact on the social determinants of health within that community. And so there are some institutions and funders that understand this, and more importantly, trust this, because I do think trust is really important in processes like this. A lot of institutions just don't trust it because it's different. But there's still definitely a lot more work that has to be done to decolonize like the current funding and investment structure.
It's really interesting, Tessa, when you started talking about that, you brought in decolonize, and definitely have been thinking about decolonizing a lot of things in my life, especially this year. But when you were talking, it really made me think about when we're in situations that we don't elevate or don't trust maybe what's going on in the community, and it seems like, you're bringing up that, you're Black-owned, women-owned type of organization, like, we can't say that we're trying to promote anti-racism if we're promoting savior design systems and not trusting communities of color as well. The communities who are in the trenches dealing with their own issues each and every day, if we can't even hear their voice, we have to even reflect, are we really committed to anti-racism like we say we are? Because it seems like if we are not able to do that, then we're just really in the business of pumping out savior design solutions. And we have to be, we just have to be steadfast in what we are and what we're not. So I really appreciate that. Julie, I know we have these conversations all the time. So I'm really interested in just hearing what you have to say, especially about the current investment structure. And there was an interesting question in the chat around, how do you have these conversations with executives? So would love to see you tackle that as well.
Absolutely. So a lot of the things that Robert and Tessa, you shared really resonate strongly in terms of kind of the way that we've been thinking here at Health Leads. And specifically really honing in on this notion of like, how do you know what investors or partners to go with? Like what kinds of questions should you be thinking about? What should you be looking for? So I really kind of wanted to kind of tap into that a little bit, and really kind of call out the role of an investor accountability in all of this. So there still isn't enough accountability amongst investors to fully prioritize equity into the way that they make investments. And that's the truth, whether you're talking about a venture capitalist, which that doesn't exist, but even amongst those making impact investments. So while their focus includes generating a positive social and environmental impact, the investment decisions still remain incredibly anchored in achieving a reasonable rate of return over a finite period. So Tessa, you had mentioned something about kind of efforts kind of disappearing once the funding was over. The same line of thinking exists here as well. And so for those impact investors who are now looking more closely at prioritizing equity, they need to really embrace the fact that social and economic inequality maps along racial and gender lines, and that tackling these disparities require a long-term commitment to diversity and inclusion. And that's not only external and externally facing, that's also internally, and it really needs to become part of their DNA. And so when we think about kind of partner selection and looking at funders, one of the things that we want to do is look inside kind of the organization as well, to kind of really get a better understanding to exactly where their mind is at and how far they're willing to reach when they talk about actually supporting or kind of innovating towards equity. Ultimately, we need to continue to dismantle these systems that reinforce the walls, especially when you think about corporate funders or healthcare institutions, between business profit and equity. which is really kind of what started the impact investing movement in the first place. The idea that institutions and organizations should be siloed and they should meet the needs of the underserved communities and integrate equity throughout their organization, that's really still very much a novel idea, with many organizations still really kind of operating separately through their philanthropic divisions of their organizations to really do that equity work. So really kind of looking for organizations that are looking for that integration and really do believe in that shared impact is something that we really kind of hope to see a little bit more of as we kind of continue forward in this space. And ultimately what needs to happen is that there needs to be a raising of the bar and upping, folks need to really up their investment in understanding DEI and building that muscles. There needs to be a return or emphasis on the notion of something that was a popular term in the past called patient capital. And that's really kind of what is needed for community engagement and investment in the community space. There needs to be patient capital to make space and the time for what's required to truly pull community to inform these solutions.
Love that, Julie. You started to really hit on kind of a challenge that could be seen for funders and health systems when you're talking about building a value case for racial health equity within these technology solutions. And that challenge that you really brought up is the timeline. And the fact that because we have not done a great job of being equitable in systems, you have to dismantle the system, which requires time. A lot of times the timeline that has been created to see change or to see a value case does not match or mesh with the timeline it takes to do equitable work or equity-oriented work. And so I would like to build off of that. Robert, bringing it back to you, just wanting to hear from you kind of what are some of the challenges you see, for funders and health systems for building a value case that's, racially or racial health equity oriented within technology solutions.
Yeah, no, it's an excellent question. And, Julie's last point really calls out a challenge that, we've been noodling on for a while, which is, in other sectors, they've always been the double bottom line, right? And in this sector, particularly if we're talking about dealing with racial equity and dealing with health equity and doing it and addressing the social determinants of health, there really has to be a triple helix when we talk about value. That doesn't always get played out. It gets played out in the rhetoric, but not necessarily in the actual measure when we talk about efficiency and effectiveness, which is how do you not just get stuck on generating and demonstrating user and financial value? Because if we're talking about addressing the social determinants of health and working towards health equity and racial equity, the heart of any venture using technology in these endeavors has to generate social value too. When we talk about engaging with the community, when we're talking about having, let me just define when I say social value, I mean having a net positive impact on the health, strength, and sustainability of communities and then ultimately society, right? And I know that's lofty, but that really has to be a calculus when we're talking about this type of investment, right? This type of value case. And there are three components to that. One is, how do you make sure that technology is not used in a way, and I don't just mean the hardware, software, I mean the methodology too, that ignores the intertwined effects of racism and poverty. That, to just borrow from President Obama, racism is a part of America's DNA and history. But so too is the idea that anyone who is willing to work hard can be blessed with being rich, that Protestant ethic. And both have played an equal role in constraining efforts around the social determinants of health, and more broadly, driving at these equity issues as a practical matter. And so these narratives have been harmful to the communities and families that we're talking about helping. And they've been especially harmful to Black, Latina, some Asian, as well as immigrant and Native families too. And so, it's left this indelible mark, particularly racism, right, on American institutions. And we're seeing this play out, for example, in healthcare institutions in two ways right now that has to be incorporated into this value proposition, right, which is, right now in healthcare, whether we like it or not, we are seeing the disposability of healthcare workers and nurses. And on the other side, we're having this conversation about vaccine distribution and logistics, and we're seeing massive distrust of the system being able to do that well and in an equitable way. So how do you make sure that when you're doing the technology interventions that you're incorporating that perspective into the conversation? The second is, as a real challenge, how not to ignore, in some instances, just simply not care about how technology incorporates how people live. How do you make sure you don't ignore the fact that it is a service, that any website, any app, any solution does not exist in isolation? The person visiting that site, using that app, using that solution always has a goal. And that technology is just part of the journey they're on to achieve that goal. So the value in using the technology has to incorporate a lens that understands racial equity, understands who and what they are makes up how they are using these things. And there has to be an ability to think about how it fits into the wider journey someone is on. What gets them there? How does it link with other parts of yours or others' physical services? Where will someone go next to achieve their goal? Thinking in service terms means that we're always thinking about where people are coming from, where they go next, and how we support them through their journey. And, just to give you a concrete example, the problem is we found during COVID, most processes require being done in person. But instead of thinking about how people live and giving a simple solution of, in-person, interview requirements and the like can all be digital, we didn't necessarily incorporate how people live into how we were actually going to use the technology. And then the third is, use technology to make the social determinants of health actionable, particularly for investors. And the investors I'm thinking about here aren't necessarily just the social impact investors. I'm thinking about healthcare systems. I'm thinking about health insurance payers. I'm thinking about those who are trying to accrue a benefit back into their institutions by making these heavy investments. And doing it by not using technology as a way to address social determinants for them in isolation. Because what is happening now, without having this kind of broader view on equity and how the social determinants kind of operate, it begs the question of, will health systems and philanthropic organizations and others stop picking one technology tool at a time and hope that it serves as a connector to all the various components of actually how these things interact? Or will they start to look to create a platform approach that does a better job of understanding and segmenting need and targeting actions from their perspective that actually meets how people live and what they're actually facing?
When I think about thinking through how understanding how people live and how they work, how they play, that really goes back to community voice and how community voice is incorporated. And, wanting to really go to Tessa, especially with the great work that Streetwise does, I just want to know, how do you ensure that the voices of the affected population, particularly people of color and particularly like BIPOC communities, are incorporated and centered in the build of technology solutions?
Yeah, absolutely. That's something that was critical to the creation of Streetwise. When we were creating Streetwise, we really thought about our grandmothers, our aunts, our neighbors, the people in our family, and how they think about their neighborhood and what they need, and creating a platform that they feel comfortable using. And so from the beginning, from the very outset, it was always meant to be, at least our work and our tool and our process and our platform was always meant to support BIPOC and other communities of color. And I think that is something that needs to be thought of on the outset, but it also needs to continuously be present in your work. We're constantly iterating and constantly co-designing with our users and with other communities of color to make sure that any decision that we make feels right and is affirmed or changed from the perspective of the folks who are using it. And so we really, really value our communities and our users in all aspects of the technical or development portion of the platform.
Thanks. Just building off of that a little bit, Tessa, I know that you all have a framework. I think it's dealing with kind of looking at things from an asset-based perspective in your approach, and would love for you to kind of expound on how you all use that, particularly in the work that you're doing in uplifting community voice, because sometimes I think that when we're interacting, and I think that this just, the bias of the system, when we come to the most affected populations who are experiencing the starkest disparities, we kind of interact with them in a deficit manner. And I'm just wondering, how do you shift that perspective to start really uplifting ultimately the resiliency that's present in those communities, and unleashing that power that's already present within that community or within the people group?
Yeah, absolutely. All of our projects we really stress the importance of being asset-based and really uplifting what the community thinks is good, what they love, what are the bright spots, where do they feel, senses of belonging and community, because you can learn from that just as much as you can learn from what's quote unquote a barrier or a deficit. And very seldom are communities asked to reflect or engage around reflecting and sharing the things that they love about their community. And in a lot of our projects, we worked in East Oakland and Newark, and doing a cursory Google search of those areas, you'd show a lot of media stories that focus on the bad. But when using Streetwise, we found that folks really wanted to share what was good and what they love. And so when you think about narrative change, when you think about the role of technology and people sharing their stories and having their voices heard, it's incredibly powerful. It's incredibly almost disruptive in a way for having tools and platforms to share what's happening on the ground from an asset-based perspective, and really filling in that gap of what's happening on the ground from their perspective, as opposed to the media or people who are looking at data but don't live there and they don't actually have the experiences of being there.
I think that's a great point. I want to bring Julie into the conversation, because we often talk about data democratization a lot and allowing people to own their data narratives as well. Like, what type of ownership, what does ownership look like when it comes to data narratives? And one thing that's really interesting from the point Tessa made is that even when we implement these technology-centered solutions, we also are not practicing an anti-racism approach if we take that data as the institution and really just derive all of these, or create the recommendations or the analysis by ourselves without it being validated by the community and with the community. That was something that was brought up in a previous panel discussion around if the data is not validated by the community when it's talking about that community, that it's invalid. And I know that that's something that resonates with you, and just wanting to know, how do you see that fitting into, making sure we're having input from the affected population?
Oh, absolutely, our chair. So I think for us at Healthways, kind of going back to the top of the hour, when our chair, you kind of shared Healthways anti-racism. That really is kind of been a lot of what we've been actually working against when we start thinking about how do we actually kind of create in concert with community solutions that ultimately are useful to the community, and data is part of that as well. So within just kind of the refresher, within the framework that our chair has showed, we showed where technology was really, a lot of technology solutions today really are kind of adhering to kind of being a solution that operates in the savior design system. So that system that's been designed to rescue, save, and deliver sources to vulnerable communities by members of folks that inherently are not part of the community. And ultimately what Healthways is trying to do is move towards an equity empowered system. And for that system, intentionally needs to reconstruct kind of the system altogether and be really focused on advancing equity of the marginalized group that we're talking about. So in my mind, the value case for racial equity, the idea of actually getting folks to kind of be able to embrace their data and control their data, really at is the linchpin in terms of actually transforming these types of systems into an equity empowered one. And then if we think about kind of technology today, and kind of the value case that's actually being articulated at this point, these solutions, the way that they're designed, already have the propensity to exclude the most marginalized folks from the start, both in servicing as well as in voice. If you think about it, many of these tech solutions have been built with the objective of ultimately being scaled, as Robert had mentioned earlier on, and our focus on reaching the greatest breadth of folks to the detriment of going deep for specific target populations. So the question then becomes, how scalable do these solutions need to be? The value case is also centered around creating a value for those who are most able and willing to be able to adopt these platforms. So when you think about these smaller nonprofits that might be doing some incredibly great work, but potentially smaller scale in terms of caseload, they may be too resource strapped, either in resources or finance, from a financial perspective, to really be able to participate in these programs at all. And then the third piece of that is the consequence of that is when you think about pulling in community, who are you actually pulling in? So when tech solutions try to bring in community voice and they actually solicit the folks that are part of their membership, who's not at the table at that point, and what kind of vision and view are you really getting in terms of kind of the input that you're getting from community? So the implications of all of that is vast. And so when we actually go out and work alongside community and kind of work alongside technology vendors, we ask a lot of challenging questions that really talk about how community members can actually sort of take a little bit more control back around their data. And so we think about things like, how does the notion of trust and privacy change when shifting from a value case for organizational stakeholders to one for racial equity? How does that broaden the conversation from HIPAA to also include the fundamental privacy concerns that some of the most marginalized people have in terms of sharing their data at all? And how should we be thinking about data ownership and management and interpretation? So what are those guardrails that will be necessary to protect individuals, and how do we need to be thinking about those use cases for the data that really meet the needs of the individual? So, where we try to push, where we really try to influence is to say that technology is not a one-size-fits-all solution, and technology should not be off the shelf. Community input is necessary and vital in terms of solutions like this, in terms of being able to understand the right types of functionalities, guardrails, and uses that ultimately will make this valuable for the community as a whole.
Thank you so much, Julie, for sharing that. I think there's some, follow-up questions that come from that. I do want to acknowledge that we want to make sure we get your feedback on this discussion. So we've just launched a poll about today's webinar. Please take a moment to provide us with some feedback. Also, I'm looking at some of the questions that participants have placed in the chat. So please don't feel shy to answer your questions. Even if we can't get to all of them in the chat, we can have an opportunity to do it offline. So please ask away. Some of the major takeaways that I'm really hearing from you all, I think about the opportunity needs to be nurtured comment that Robert made, and how we can't just put out a technology solution. This is something that all of you talked about, and expect for it to address disparities. And if we are saying that we want to be anti-racist and this is our approach, then those things are not lining up. Another thing, Tessa, you really have done an excellent job of talking about the value of community voice and looking to have technology complementing what the community is already doing, and making sure we're not being biased or promoting racism by not hearing that voice and that voice in the way that it needs to be. And Julie, you've really started to hit on a lot of ways that we need to rethink the value case of social determinants of health interventions as a whole. If we're only thinking about process efficiency, this is kind of why technology is getting a lot of attention right now. But what we're missing from that is how critical community engagement is, as well as the last piece that you're talking about, expanding the considerations around the topics that go along, or the components that go along with social determinants of health interventions, like data privacy. How do we go beyond HIPAA to also understanding what does data privacy look like for the community? There was a question that I wanted to bring up, and I think it's really pertinent in the time of COVID-19, where we're seeing that the systems that were created and the way that we're approaching social determinants of health to just really be about resource connections is limited. And this participant really wanted us to go deeper in how technology should facilitate or should partner with community to address root causes. So the point that the participant was making is that the resources, or the availability of services and resources, are inequitable, and they're distributed inequitably. So information and a referral-oriented strategy can be a bridge to nowhere. So what is the business responsibility for driving, or at least supporting policy to increase or to decrease institutionalized racism in housing, education, health, food, transportation, et cetera? So how are we looking to use some of the work to support policy to dismantle some of these systems? And I know that was touched upon a little bit, but wondering if we could go deeper. Robert, would you mind starting us off?
Yeah, so I think, it's an excellent question, and it's the right question. And the responsibility is, squarely on not just the community to kind of figure this out, but also the institutions that, benefit from the resources in community. It's the reason why I'm talking about intent, right? It can't just be a taking activity, right? And so if we're just sticking with social referral platforms, that can't just be an extraction from community of information and services. There is a responsibility on the part of the institutions who are premised with this. We're going to screen our folks for their social needs and then refer them out into these communities, into this capacity and this infrastructure. That there's also an attendant responsibility with that to partner with those communities. And I don't mean just kind of listen to them. I mean to make them part of the resource equation, the investment equation, so the community is actually part of that cycle as well. And that means incentivizing, but also encouraging and holding accountable the folks that you work with that go into these communities that engage in that type of effort. The reason why I'm saying that is because one of the things, if we're really going to hold ourselves accountable, but hold institutions accountable, and we've heard this throughout, the conversation here, is that we really got to do some basic things, right? We heard start with the community needs and keep them involved. Well, that's a part of the accountability. Like before you build, design, invest in anything, you have to actually understand what the needs are. And those needs aren't just about social needs. It's also about the investment needs. It's about the capacity needs. And then truly gain an understanding of their situation and behaviors and problems and goals. Right. And that actually means really, really not just doing this at the start, but doing it throughout the process. That's one way we have to engage in this. Another is that when we are absolutely doing this, it means being inclusive. And that's not a one-way conversation. Being inclusive does not mean that, I've talked to a couple of, community service agencies and, I've kind of heard from them, but you don't include them beyond the initial conversation of you designing your program or your intervention or your RFP or whatever it is that you're doing. You actually have not engaged in the resource question with them. And so you have to be inclusive. That's not just a throwaway term. That is a real thing. That, what is it that's going to affect your choice of technology? What is it that's going to involve you thinking about the content and ensuring that, what you're giving is really a business case that is clear and accessible? How are you going to make sure that you're ensuring that the service work for people who have different needs are being incorporated? And how are you designing for inclusivity from day one? Day one.
I really appreciate, again, the notion of inclusivity. I do want to ask Tessa a very specific question because of the work that I know that you all are doing. Just really thinking, taking what Robert is saying, and I think that there's just a practical use case with the work that you all do, Tessa. That what Robert said made me think of this. You all really do a lot of kind of what I call local community organizing work with that technology, like that the people have the power to advocate or say what a need is in the community. And a lot of times when we think about the big P or, policy, the big P in policy, we're thinking state and national, policy. But there could be a lot of work that's done at the local level where you have technology that's empowering communities to be able to say what are the root cause issues within their community and have technology that provides them with data to support that. And I believe that kind of aligns with some of the work and efforts that you all do, and would love for you to speak to that.
Yeah, absolutely. I think when you think about addressing the root causes and the big P in policy, data is a big part of that. And the data that's used oftentimes is old and outdated and inaccurate and takes years to collect. And so when we think about the role that data has in making those decisions, how do we ground truth that data with community voice? How do we make it more accurate with community data and community voice? And like you said, Arter, it can happen at these small local levels where communities express concerns that they're living with. They are the experts. They're closest to the problems, so they're closest to the solution. And we really think that their voices need to be upheld as experts in the community. And what's missing is a two-way feedback loop where communities can say, hey, this park should be closed. It's actually a brownfield and it's emitting toxic pollution, but the fence is open and it's broken and the sign is in English and we speak Spanish and Portuguese. Like there's little things like that where if there's a two-way feedback loop where communities can express that easily and that fact can be then sent to community members. That's a real example of what we've done in Newark. That was a park that community members were suffering from and using, but didn't know that it was toxic. And when they used Streetwise to map on that, and so many community members kind of mobilized around that, they were able to share it with city council, with their local council member, and get some quick, very easy fixes to fix the fence, get a better sign. And so when you think about that two-way feedback loop, it can be used on a much larger scale when you're thinking about data and ground truthing data and actually addressing some of these root cause issues with the presence of community voice, as long as there's a platform that feels good and easy for people to use and is creating that feedback loop.
Yeah, and Tessa, what was really interesting, I feel like you hit on a question where it was talking about stepping back and asking community if your interest is important to them, and how it is important to design your research around that. What I think is really interesting and great about Streetwise is that you all let the community set the priorities for the use case of the technology. And so I think it's a thing where you can do both, where you can ask the community if their interest aligns with your interest. But what I think you all do so well is really continuously designing around the community priorities. So it seems like that your work was even built off of a community priority, and hoping that we can start doing more of that. Julie, you talked a lot about the tech companies earlier, and there was a question of, just cultural consideration questions that should be brought up when interviewing tech companies. I'm assuming that's around social determinants of health solutions, and just wondering if you had some interview questions that people should be thinking through.
Yeah, sure. I mean, I think it's kind of an evolving set of questions, but I think probably the first and foremost important questions to kind of really understand is actually where their mind is at in terms of who they've actually worked with in the past, and kind of the way that they actually work with different partners. And then actually kind of understanding how they show up themselves as they kind of go through the implementation process for these types of solutions. So a lot of what Tessa, you had mentioned, you would want to kind of know that these technology providers actually had kind of embraced that mentality, and even potentially have a point of view in terms of how they themselves might show up at the front end. And then there's some really tactical things that you can actually ask around the degree of flexibility around functionality, prioritization, speed of actually build, that really kind of come into play, that actually kind of help to send out signals in terms of their willingness to kind of really move at the pace that community does. I think that would be the first questions that I would ask. And then I would say as things go, as the relationship builds, just really kind of always checking to make sure that that investment in equity is actually there.
Yeah, I really appreciate that. And I would just part two of that, Julie, someone mentioned that, how do you account for reducing or eliminating coded bias that creeps into technology as a result of structural racism, unconscious bias, and race-based medicine? And could that be incorporated into some of the interview questions, as well?
Absolutely. When I think about data sharing, I think a lot of technology players really kind of treat that piece of their responsibility as kind of a template or something they've used in the past. But the reality is when you think about data sharing or you think about extraction of information, it really does need to be really accommodating to the specific community. So really just a recognition by tech vendors that it is their responsibility. It is part of their responsibility to take on the shepherding of that. It's not that there is an accountability associated with their ability of facilitating the extraction of data. Just being able to hear that in interviews with the technology provider probably sheds a lot of light in terms of where their heads are at, and how profit-driven they are as opposed to equity-driven.
Robert, I wanted to see if you had something to add on to that as well before we go to our last question?
Particularly on that last question, it's both, what are their principles around digital service, but it's also an organizational question too. For us, what we have found is it's not just enough to have service principles that drive you that way. You also have to have folks who actually have that perspective. And so, something that Tessa said at the top that's really, really important about our organization and then design is it's not just built into the practice, it's actually built into the people and the experience that they have and their perspective. Because, when we code, when we build this technology, it is really a reflection of ourselves. And so, it is important to ask organizations who are working in these communities, not just, what their perspective is on the communities, what their practices are, but are they, as an organization, as an institution, in their policies, their procedures, their way of thinking about inclusivity with their own kind of workforce, as well as structurally the culture that they have, does it match? Because you can say one thing, but be doing another. And that's how those type of inequities actually show up in the coding, because it's not intentional. It's actually a lack of perspective. And so for us, it's kind of a both and question, right? It's, what are your service principles? What are your design principles? But also organizationally, what are your principles around recruitment, and where do you recruit from? And how do you actually do your user research? And what methodologies and frameworks do you actually employ before you even design anything?
Yeah, I really appreciate that, especially realizing that we may even have to shift perspectives as well. Understanding, I guess, the match that you're talking about there of like, what are their service, kind of what are their service agreements? How do they design around inclusivity, equity, making sure there's a match between what is said and what's actually done. That's what I feel like I'm hearing you say. Is that correct?
Mm-hmm. That's right. Do you practice what you preach?
Yeah. I want to thank everyone for attending. If you have any questions or would like to learn more about HealthLeads, you can contact us at network@healthleadsusa.org or healthleadsusa.org/network. We'll be sending this webinar out to all who attended. All who registered. So feel free to share with different colleagues. I want to leave the last word though to you three, and just saying, what is one thing that people should think about if they're designing an equity-oriented technology solution? So what's one component really quickly that they should really be thinking about? I'm going to start with Tessa. What's one thing that they should think?
Oh man, I get to go first. I would say just going back on making sure you have the right people at the table and actually doing that internal work. Like, am I the right person to be doing this? Is it reflective? Is my voice reflective of what I want to create? If not, how can I resource and support the voices that need to be leading this instead of, trying to create something that's not connected to who you are and your struggles and your lived experience?
Great. Julie, one thing.
Willingness to work with different set of partners. We are trying to dismantle a system and rebuild it in a better way. And so we all need to kind of get used to working with folks that we haven't ordinarily thought about working with, and really trying to figure out how we build something better.
Thank you. Robert, last word. What's one thing?
Be inclusive. Like, inclusivity should influence every part of your design: technology, content, service.
Thank you very much. Hope you all have a great day. Thank you for joining us.